Hi. I'm really sorry I can't be with you in person today, but it's a real privilege to be able to talk to you about personalisation and what that means to me as somebody who lives with several long-term health conditions. The experience and journey I've been on since my various diagnoses has felt like over time each little part of my life that was important to me has been taken away. And it's been replaced not only by the standard symptoms you'd experience with a neurological condition, but by a myriad of other things: depression, anxiety, fear, and also much wider implications in terms of career, social life, relationship, friends. What my life looks like now is completely different, unrecognisable from how it was several years ago. It's felt like I've surrendered any of my defining characteristics. Anything that doesn't relate to my nervous system, I'd sort of given up on being. But through this journey, and through discovering self-management, I've been able to reframe this, and started to find a way of actually living a healthy life. Discovering the role that I can play as a patient has really changed this journey, and I think is going to change where I end up. I've learned that just addressing the straight medical and biological problems isn't going to solve everything. I need to learn how to live and how to have some quality of life in between my many medical appointments. And that requires me as a patient, as an individual, to take control and to take responsibility. Though that's not something that's just only required, it's something that I actually want to do as well. It's more than just a means to an end. The journey of being a patient with a long-term health condition can be very disempowering and pretty lonely as well. So, irrespective of what the clinical outcomes are at the end of the day, things like being in control can make that journey so much more bearable. And these changes can come about through the interactions I have with my various healthcare professionals and my experience of being a patient. So it's really important for me that I'm able to access a service easily and effectively, and that I have a single point of contact, for example. But it's also really important that when I do have that contact, that dialogue between me and the healthcare professionals is one that embodies all of these principles of self-management and personalisation. And it is really important that self-management is supported, because although it's called self-management, actually, in order to be effective, it requires so much more than just me doing the right things. It's a partnership and it's a team effort, but I'm just the captain of that team. No matter how engaged I am and how informed I am about my condition, how well I'm doing various exercises and taking my medications, and no matter how much I'm trying to manage some of the more difficult symptoms such as pain and fatigue, if I'm met in a consultation with an attitude that doesn't support that, encourage that or complement that, then I find self-management very, very difficult. In a consultation a while ago, my doctor, when finding out that I'd been on a self-management course, commented that "That's great, you won't need me anymore." And I'm still not entirely sure to this day whether he was joking or not. Just because patients are self-managing doesn't mean they need the system any less. It just means that those interactions with the system are more helpful for everybody involved. And self-management isn't just a discrete interaction between the service and me. And it should be evident throughout my whole journey, my whole pathway through the NHS. So it's a mindset and it's a behaviour that I embody as a patient, but it's equally important that the staff embody that as well in order to support me. From my perspective as a patient, the current NHS system looks like a really higgledy-piggledy jigsaw, but most of those pieces are very, very clinical. They've all been taken from the medical model. And the medical stuff is really important. It keeps me alive, and that's great. But it's only when I have a combination of medical, psychological and social support that helps me work towards my goals and the things that are important to me, is that when I finally manage to find some quality of life. And although it's obvious in the name, long-term health conditions, when you live with them, you are living with them for a very, very long time. And even though I introduce myself today as somebody who lives with a long-term health condition, I still can't quite get my head around the timescales we're talking about. I'm going to be living with this every single day for the rest of my life, and I'm 24. So suddenly, when you see these things on that kind of timescale, the difference between just being alive and actually finding some really meaningful quality of life is so much more important and becomes so much more clear when you're looking at over several decades. And even over weeks or months, it can still make the most enormous amount of difference. In order for the system to be as effective as possible for both people like me as patients or carers using the service, or people such as yourselves providing it, this jigsaw needs to be using pieces that come from outside of the medical model to really effectively support self-management. There is also one other piece of the jigsaw which I think is fundamentally important at whatever level we're talking about, and that's patients, people like me. And we can really help start to pull that jigsaw together and help the pieces all slot in a nice tidy way. We can only do that if we're integral parts of the jigsaw, not just afterthoughts, add-ons, or pieces that have been chucked into the mix but long lost and forgotten. Self-management for me has enabled me to really turn this journey around and to instead embark on a journey which is not dictated by my long-term health conditions, but a journey that I want to go on. Being an active self-manager is really, really empowering, but it can also be very disempowering if you come across brick walls, services and systems that can't support and facilitate that self-management. We look forward to building the jigsaw with you to make it work for everybody. Thank you.